Welcome to our unit on blood flow through the heart. We're going to take a look at the blood flow through the heart and the order in which it goes. It has a very particular path. If you need to review the components and the anatomical parts of the heart, please watch our video previously where we did this. It'll be linked below for you. Talk about the two circuits of blood flow. So really, I've got two pictures here. The heart is in the center, and we've got the lungs here on the left side, and we've got a picture of the human body on the right-hand side. When our blood flows to the lungs, we refer to that as the pulmonary circuit. And if you review in our respiratory section, you will see that the word pulmonary does refer to the lungs. So we call all of the blood flowing to the lungs and then back to the heart the pulmonary circuit. The other portion of blood flow is referred to as the systemic circuit. And that's because it's basically everything but that little portion that goes to the lungs. And so it goes through your entire system. So we refer to it as the systemic circuit. We start blood flow and our discussion on blood flow by looking at the right side of the heart. And I need you to remember, and again, if you rewatch that previous video, the right side of the heart is this one here that is covered in blue. And it's actually on the left side of your screen. You can see this teal arrow coming in. All of the blood has just been circulating around your body, and it is returning to your heart to the right side of the heart. It has just dropped off a lot of oxygen, right? Our body utilizes oxygen in order to create energy and to keep us moving. But once all of those cells have dropped off the oxygen, its main goal is going to be to come back to the heart to pick up more oxygen. And so it comes back to the heart through this right side. And again, remember the right side is the side that's more on the left side of the screen because we're looking at the face of a patient. Okay, we're going to begin our circulation through the superior and inferior vena cava, and you can see those indicated here with the two teal arrows. So the superior vena cava is the last vein into the heart from the upper portion of the body. Again, superior means to be above. And the inferior vena cava is the last vein into the heart from everything below about heart or chest level, to bring all of that blood into the heart. Superior and the inferior vena cava empty their blood into the right atrium, which is now this arrow has moved down a little bit and it's pointing into the right atrium. So I know it kind of seems like it comes in from above and from below, but both of their openings are in this right atrium, so the blood enters there. Next, we're going to have to go past a valve. And valves are really meant to keep blood flowing in the proper direction, right? So it looks like it almost opens in the downward direction. This allows the blood to flow from that right atrium down towards that right ventricle, but it's not going to allow blood flow to back up. Okay, that would not be ideal for our body. We want to keep it in a one direction flow. So all of the valves we talk about today is really meant to keep it in the one direction flow. And the valve between the right atrium and our next location is the tricuspid valve because it does have three flaps. Remember from our medical terminology portion that tri is the prefix for three. Next up, the blood is going to head to the lower chamber in the heart, which is the right ventricle. So again, it is simply just moving down from the atrium into the ventricle on the same side of the heart. Next, we're going to head through another valve. And again, the valves are just meant to keep the blood flowing in one direction instead of back flowing. So the next valve that is up is the pulmonary valve. So it will go from the right atrium and it's going to pass by the pulmonary valve. The pulmonary valve is named the pulmonary valve because it is heading in to the pulmonary trunk. Okay. The pulmonary trunk splits off, makes almost like a little T shape, and you can see one kind of sneaking underneath the aorta. Those are your pulmonary arteries. One will be the right pulmonary artery, one is the left pulmonary artery. And then hopefully you remember that the word pulmonary refers to the lungs. So once it goes up, that pulmonary trunk splits into your two pulmonary arteries. They are going to lead into our lungs. And what's happening when they get to the lungs is that they are going to pick up oxygen on those blood cells, because that's really what the whole purpose of circulation is to pick up oxygen. And this is the portion that is picking up the oxygen so that we can do the second half of our circulation, which is to take it out to the body. Now we have done the difficult job of circulating through that right side of the heart and picking up oxygen from the lungs. We need to head back towards the heart to send it out through the body, or that systemic circuit. Well, we're going to do that by coming back to the heart by 4 veins, which are called the pulmonary veins. So you can see that they are here with those nice little teal arrows. There are 2 from the right and 2 from the left. Okay, so while 2 look like they come from the right and 2 coming from the left, all 4 of these actually empty into that left atrium. So the ones on the right-hand side actually come all the way behind the heart, and their opening is into this left atrium. Next, they are going to go past another valve called the bicuspid valve, which has 2 flaps, as that prefix bi will have you understand. It is sometimes called the mitral valve as well, so that's why I put both here in this presentation. So the bicuspid or the mitral valve, you will hear both of those commonly used. So once it passes that valve, we are going to head into the left ventricle. All right, remember that the blood always goes from the atrium down to the ventricle on the corresponding side of the heart. From the left ventricle, we're going to go past another valve called the aortic valve, which will lead, just as it sounds, out the largest artery of the body, which happens to be the aorta. So this aorta makes a giant arch. It actually comes down behind the heart and will go all the way down into the abdomen and the pelvis. I've only just shown a portion here. From the aorta, we are going to circulate all of this nice oxygenated blood all the way out to all of the components of your body, all of your limbs, all of your organs. It is going to drop off oxygen for use to make energy. And that is the systemic portion of circulation. Okay, once it is done, we're going to start over. Okay, so now that we've dropped off all of that wonderful oxygen, we're going to return back to the right side of the heart, and we're going to start this circulation process all over again. So, oftentimes we refer to the blood that is in the right side of the heart as deoxygenated blood. It's not truly with no oxygen, but it's extremely low because we have just dropped it off throughout the body, and it's often colored in blue or a purple color because that's what the blood cells tend to look like. They're a little bit darker when there's no oxygen on them. And when we have blood returning to the left side of the heart, it has just picked up oxygen from the lungs. And so we often refer to this as oxygenated blood. And the left side of the heart, the atrium and the ventricles, are often shaded in much more of a pink, a red sort of color because the blood cells look much brighter when oxygen is attached. So it does tend to have that more reddish pink appearance. All right, let's do a quick review before we're done. Let's see if you remember the entire flow. Okay, remember we started at the superior and inferior vena cava, which emptied all of its blood into the right atrium. It goes past the tricuspid valve on its travels into the right ventricle. The pulmonary valve is next, which leads into the pulmonary trunk, which then makes a split into two pulmonary arteries, the right and the left pulmonary artery. Those head out to the lungs to pick up oxygen. It returns back to the heart by the four pulmonary veins, which empty into the left atrium, go past that bicuspid or mitral valve on its way to the left ventricle. Then we are heading out the aortic valve into the aorta, which leads out to the entire body, or that systemic portion, before we are heading back to the very beginning of that superior and inferior vena cava to start circulation all over again. Thank you for joining us on this review of the heart.